Top story, medical, pharmaceutical and dental interns have been urged to stop their internships and stay home following the frustrations they're encountering in their working environments. Well, this follows the death of a pharmaceutical intern at the Thika Level 5 hospital who's said to have died by suicide. The Kenya Medical Practitioners, Pharmacists and Dentists Union claims interns have not been paid for 4 months, and this could be just the tip of the iceberg as they accuse the Ministry of Health of making empty promises.
The death of 29-year-old Dr. Francis Njuki Gashimo, a pharmacist intern at Thika Level 5 hospital, highlights the level of despair that surrounds the medical internship fraternity in Kenya.
Wakaweza kutoa hiyo mwili na ikapelekwa mochari hapa Thika Level 5.
Dr. Gashimo's death now comes months after the death of Dr. Desiree Mora, who was a medical intern at Gatundu Level 5 hospital, as she also died by suicide.
This now brings a total number of 2 interns who we've lost in 2 months under the same similar circumstances. I'm also aware of 5 other interns who have attempted suicide. Unfortunately, were rescued and hospitalized.
The culmination of the 56 days doctors' strike revealed the light at the end of the tunnel, as interns were promised they would receive their payments after 60 days of negotiations between the national government and the doctors' union. Evidently, those talks took a different trajectory, as KMPDU accused the government of dragging its feet even after a court ruling. Now the interns say they feel cheated. NTV caught up with some interns who are now 4 months into their internship without pay, and this is the case.
You have to realize that also the government and also the counties, they've not done a very good job ya kuemploy many doctors. So that defect is covered by medical interns.
For most doctors, even those who are practicing at the moment, I can say that internship has been known to be a very toxic time of their lives.
The same Kenya Medical Practitioners, Pharmacists and Dentists Union that urged interns to go pick their letters awaiting negotiations now admits it is at its wit's end.
We are asking all the medical doctor interns across the country in all the facilities to stay at home immediately. That we will not afford to see any more deaths out of desperation, despair and disillusionment that are caused by hard-working conditions.
The interns say most of them have been pushed to the wall, and the reality of the risks at hand stares at them on a daily basis.
Most of us, we have to interact with the highly infectious patients, patients with HIV, patients with the TB, and especially doing blood dogs for them. Especially patients with HIV, if you do blood works, then you get a needle prick, an accidental needle prick. It can be very bad for you, because for us, we don't have any risk allowance. Personally, I don't have a health insurance yet. So it's sad that we are offering services, and the same services, we cannot afford them.
According to the collective bargaining agreement, interns were to be paid 206,000 Kenya shillings, but the SRC circular indicated that the interns would be paid 70,000 Kenya shillings, a move that the unions say has seen them in and out of negotiations. KMPDU now says it will proceed with a nationwide strike notice in December. While the Kenya Kwanza government strives to attain universal health coverage, the puzzling question is who exactly is going to be on the front line of its actualization, as healthcare workers are now constantly complaining about frustrations and harsh working environments, and the issue of unpaid medical interns. And while the silent wars continue, unfortunately, it is Kenyans who will have to bear the brunt of this battle. Helen Aura, NTV.